Judges Tiffany Kern Alili on the line. We'll go ahead and get started as soon as I hit recorded. 1 second. All right, we are recording. Thanks again for joining us. Today we'll be discussing general COVID updates to include updates on Rota and Tinian. Dio?
Hi. Half a day, Interior, everyone. So I want to give, our sincere appreciation to the healthcare and public health workers who have been working hard over the last 2.5 months to contain the cases of COVID-19 in our community. They are indeed true heroes. I also want to thank the people of the NMI for coming together to protect ourselves and our families. Our 97.5 vaccination rate is exceptional and makes us a global leader. While we have seen a major decrease in cases since the beginning of this current wave of infections, the total number of cases and hospitalizations still remains too high. We are used to seeing 30 to 40 cases a month, not in a day, and for the first time ever, we have cases in Rota. We still need to protect ourselves and our community from COVID-19. While we have no reports of Omicron in the CNMI, this variant is spreading worldwide, and we must be prepared for a new wave of cases. The CNMI has had a total of 20 tragic deaths since the beginning of the pandemic. The average of those who died was 67 years old, compared to 30 for those infected in the general community. All had other chronic health conditions. Most of these individuals were diagnosed too late to use treatment with monoclonal antibodies. 14 had never been vaccinated or had a single dose, and 6 were fully vaccinated with 2 doses. Most of those fully vaccinated were vaccinated very early in 2021 and not up to date on their vaccinations. Only a single person had a booster. The unvaccinated were 14 times more likely to die than the vaccinated. Of the 95 people hospitalized since December 1st, 55 were unvaccinated or incompletely vaccinated. The unvaccinated are 8 times more likely to be hospitalized than the vaccinated. So we're asking individuals to please seek care or test early if you're experiencing COVID-19 symptoms, as you may be eligible for monoclonal antibodies or other new drugs that are given soon after infection. The continuing cases, hospitalizations, and deaths in our community is an opportunity to remind everyone that the pandemic is not over. And with updates from Rota, we have 6 cases isolated and actively monitored. 40 close contacts were identified, all tested negative. 735 tests were conducted from January the 9th to the 13th. That excludes the DFEMS testing, which is 230. Daily surveillance testing is available at Rota Health Center Monday through Saturday, 1 to 3 p.m. Vaccination operations for Rota are scheduled tomorrow, January the 15th, from 8 a.m. to 1 p.m. at the Rota Health Center. In regards to Tinian, the updates from Tinian, 8 cases, 4 of those to be announced tonight, isolated and actively monitored. 53 close contacts were identified. All have been tested, were negative, and contact tracing is ongoing. 73 tests conducted from January the 10th to the 13th. Daily surveillance testing is available at Tinian Health Center Monday through Friday, 1 to 2 p.m., Saturday, 12:30 to 2:30 p.m. I want to remind everyone that we are a single hospital health system. We have 1 emergency room and 1 hospital, again, in the CNMI. As a health department, we're working closely with our federal colleagues to be prepared for increase in hospitalizations, And we really need the community to continue to come together, and let's help each other reduce hospitalizations. CHCC will continue to provide community testing, vaccines, and drugs to treat infections. We are preparing for any new surge of cases to our hospital and on the alternate care side, and we'll continue to monitor for the Omicron variant. We need everyone's help to stay up to date with their vaccines, including booster doses for those who are eligible, especially if you are over 60 years of age or have chronic conditions. We also urge everyone to wear a good fitting mask in enclosed spaces with people who may not be especially with people who may not be fully vaccinated. And of course, wash your hands and watch your distance. If you are experiencing any symptoms, please seek care and see a provider right away to get screened and tested. If you are COVID positive, you may be eligible for monoclonal antibodies or other new treatment that are given soon after infection. So COVID positive patients can get assessed for monoclonal antibody treatment at the COVID-19 Community Center in Cloverville. Again, together we can learn to live for COVID safe at work, at school, and play. Thank you.
Stephanie, would you like to add something?
Thanks, Gil. And just wanted to say hello again to all the media today, as I have returned to continue my epidemiology support to the CNMI. So back in action. I wanted to really thank CEO for her remarks. Really important is to continue to encourage folks to mask up and stay home if they are feeling any symptoms, and to avail of the increased capacity of testing. I also wanted to draw attention to our boosters. Just like our vaccination rate here in the CNMI, it is much higher than a lot of areas in the world. Though if you are 18 years or older, and now 12 years and older, and you are eligible for that booster shot, I would encourage you to go ahead and get that booster shot. We're at about 40% of those who had received their second dose of either of the vaccines for those 18 plus have had their booster shot. So we have a lot of folks that are still eligible. So I would really recommend it. We know that immunity does wane over time after those shots. And because of our early strong vaccination, a lot of folks are eligible now. So really want to encourage those booster shots for those, and also remind folks that the eligibility has now increased from the CDC side for those 12 and above, that Pfizer vaccine. If you are eligible at 5 months past your second dose. Other than that, I just wanted to provide some information regarding our cases. A lot of our cases are still reporting a lot of household transmission as well as gatherings. So wanted to encourage folks. I know it was just the holidays, but continue to encourage folks to find alternatives to in-person gatherings with your family members, like birthday parties, etc. Maybe keep those at smaller numbers, or try to limit the number of folks who are there, as well as make sure that you're using some of our 3Ws. Ensure that you're practicing those 3Ws, even if you do choose to have some of your birthday parties or other gatherings that you have. Other than that, that's it for me, Gil. Thanks so much for the opportunity.
Thank you, Stephanie. Thank you, CEO. All right, partners, we'll open it up to questions. Please raise your hand and I'll call on you. Thank you. Yes, Tomas.
Hi, thank you for the update. Just wanted to ask if we could get a clearer picture on the spread for Rota and Tinian. Is there travel history? What are some of the indications for origin of spread for Rota and Tinian?
Sure, CEO, do you mind if I take that one?
Yes, please. Yes, please.
Of course. Thanks, Tomas. I really appreciate the question. In terms of our cases on Rota and Tinian that have been recently identified, many of them are reporting contact to one or the other. Some have reported travel history from known areas with high rates of COVID-19, such as Guam or the mainland. So we are seeing some, but we are also noticing some cases that are linked to one another who may be in co-working settings, and as well as family members, travel companions, and such. So just wanted to bring those details that those we are seeing that there is a lot of cases of COVID globally right now, especially in areas where people may have recently traveled from. So some of the cases on Rota and Tinian are travel related, and some of them are some have working exposure. CEO, if you want to add, please feel free.
No, I have nothing to add. Thank you.
And my next question is for the CEO. Sir, I just wanted to ask you what your thoughts are on the Rota Mayor's proposal to require vaccination cards to be presented before boarding inter-island flights, and also just your opinion as the chief public health official, how inter-island travel should be dealt with given the news of the spread.
Well, we've sorry, let me go ahead and put. For us, we have to be mindful that, again, there's always mitigation measures that is in existence, and there are therapeutic treatments. Right now, even though there has been cases in the island of Rota and, of course, in the island of Tinian, there is contact tracing. There's the public health measures that are in effect. We have gone there and, provided the support. There was actually one of the positive cases that received monoclonal antibody treatments. So it can be done there. There's that support. And in regards to requiring that testing, it is, we have to be mindful too. I mean, and maybe in the near future, because I know that we have been discussing this with the federal partners, is to try to get access to these home test kits. And for us, if that can be provided and we can freely give that to everyone, I think it is a good idea. But right now it is not available. It is not available for everyone, and hopefully soon it will be. And I think that's where it's important to say, yes, maybe, and it's also a responsibility for the individual. I think every individual has a responsibility to protect the people wherever they're meeting. And if they're going to go to Rota, practicing the 3 Ws is very, very essential, as well as, maybe, and we have the availability of testing here. So, of course, whether it's a PCR test or the antigen test that's conducted at DFEMS, you could have that extra protection. But to require everyone to do it, again, it's always accessibility, affordability, and those things. If those things are there, then I definitely 100% support it. But when there is lack of accessibility and affordability of these tests right now, I would, I have to be basically express caution on requiring something like that.
All right, thank you. That's all for now.
Thank you.
Thank you, Tomas. All right, Maureen, you have the floor.
Thank you. Good afternoon, ladies. So most areas